Metabolic Code Product Training, EstroMetab 2.0. EstroMetab 2.0 is a TRIAD 5 product that was designed to support estrogen metabolism in both men and women, obviously. But it also has other impact on your chemistry. So keep in mind that even though this is a TRIAD 5 product, it can have a global impact on the durability and the resiliency of an individual. It consists of kudzu root extract that's standardized of 40% isoflavones, diindolylmethane, grape seed extract, all in full clinical doses. So the goal of EstroMetab 2.0 is to support healthy estrogen metabolism in both women and men. It reduces estrogen dominance by improving estrone and estradiol metabolites to friendly metabolites. It reduces estrogen-related fat gain because of that and improves the 2-hydroxyestrogens to the 16-alpha hydroxyestrogens ratio. And I think you'll find it'll have an impact on the 4-OH estrogens as well. You know, the importance on estrogen metabolism is pretty clear, is that if we make the unfriendly metabolites, it ends up creating more free radicals. And those free radicals are damaging to tissues and can end up creating quinone adducts, which create DNA damage and can lead to cell dedifferentiation. Now, part of it is that we have adequate detoxification enzymes, and hopefully, in addition to giving EstroMetab 2.0, you would make sure that glutathione functionality is at peak, because glutathione binds to most 99% of the quinone estrogen and then inactivates them. So the 2-hydroxyestrones are obviously the healthy estrogen metabolite. It's known to decrease in obesity, decreased with high animal fat diets, meaning the higher the animal fat diet, and when you're not eating a lot of vegetables and fiber to go with it, you will lower your 2-OH estrogens. It also decreases with the use of Tagamet. It also is increased when you exercise. And then if it's quality protein that's lower in fat, you improve your estrones. And then obviously the cabbage family of foods increase your 2-OH estrone related to your 16-alpha estrogens. Now, you know, the 16-alpha is a bad estrogen metabolite and obviously an immediate precursor of estriol. And it's the ratio of 2-OH estrone to 16-alpha is predictive in one sense with breast cancer. There's been, and a lot of people now are talking about the 4-OH being more important, but there's a lot of data on the 2 to 16 ratio. There's plenty of data on it. And obviously the bottom line is we're trying to increase 2-OH, decrease 4-OH and 16-alpha. Signs of estrogen dominance in women, all of you know this, you've studied it, but you know, decreased libido, cold hands and feet, irregular heavy menses, weight gain, water, edema, holding on to water, swelling or tenderness of breasts, sleep problems, mood swings, irritability, mood changes, depression, anxiety, weight gain, and then of course headaches, and you can get PMS with estrogen dominance, and of course in menopause, with estrogen dominance, that's where we see the rise in their breast cancer risk, right? Because they're only making more estrone estrogen. Female estrogen dominant leads to a lot of different issues: insulin signaling problems, thyroid autoimmunity, obesity, fibrocystic breast, ovarian cysts, fibroids, migraines, and of course the most dramatic effect is the increased risk for cancers. And then in men, similarly, decreased libido, erectile dysfunction. They can get hair loss, gynecomastia, insomnia, fatigue, decreased cognition, mood swings, irritability, depression and anxiety, weight gain, again, loss of muscle, and even loss of bone. So in male estrogen dominance, we obviously chronic inflammation and thyroid problems and prostate problems, including BPH, stroke risk, myocardial infarction, arteriosclerosis, peripheral artery disease, weight gain, and decreased bone mineral density. I think it's interesting that a lot of times we look at estrogen metabolism, we hear estrogen, and we think, oh, that's women. No, as men get older and they're either not making enough testosterone, or the testosterone they are making is getting converted to DHT and estrogens, the issue of estrogen metabolites becomes a big problem because there's aromatase upregulation. One of the biggest things you can do to support that, of course, is to give zinc. And I've always loved this slide. This is typical of what happens as men take on estrogen in their metabolism as they're aging. So EstroMetab 2.0, diindolylmethane, 300 milligrams in 2 capsules. Kudzu root extract, which is standardized to 40% isoflavones, that's 500 milligrams in 2 capsules. And grape seed extract, 200 milligrams in 2 capsules. This particular product is packed with 2 capsules containing all 3 ingredients at a clinical strength. Now, the typical dose is 1 capsule in the morning and the evening. So diindolylmethane, obviously a metabolite of indole-3-carbinol. It's a glucosinolate compound. It's derived from cruciferous vegetables. It helps with improving estrogen metabolism and also could improve free testosterone levels as well. I took the slide out of a chemopreventative study that was published. This was experimental in human studies, not so much to show you, oh, look what this does for cancer. It's really more important to look at what it's doing. It's reducing excessive VEGF signaling, excessive MMP9, excessive NF-kappa B signaling. So it's really having a global effect on maintaining homeostasis versus that march towards metabolic inflammation, because we see it. If you think about women who are insulin resistant, they've got autoimmune thyroid, they're estrogen dominant, they're 45 to 55 years old, they've gained 40 to 60 pounds. You've got a lot of metabolic inflammation that's going on. It's leading them down that path towards dedifferentiation. Diindolylmethane is one of those ingredients that's been shown that can really help to put the brakes on that inflammatory signaling process. It stimulates cellular detoxification pathways. There's modulation of something called the aryl hydrocarbon receptor, and there's crosstalk between that receptor and the estrogen receptor, the alpha estrogen receptor. And it promotes transcription of genes that stimulate expression of detox enzymes, including phase 1. It stimulates NRF2, which is going to help with regulation of homeostasis, and enhances excretion of genotoxins and induces significant antioxidant effect. And then it also helps in the reduction of inflammatory signaling, like inhibiting COX-2 pathways. 2017 randomized placebo-controlled trial on 98 women that were on tamoxifen, randomly assigned DIM, 150 milligrams BID, or placebo over 12 months. So it improved the 2:16 ratio. It increased sex hormone binding globulin. There was no change in breast density. Plasma tamoxifen metabolites, endoxifen, 4-OH tamoxifen, and N-desmethyl tamoxifen reduced in DIM versus controls. So this is something that you can think of. A lot of times we think, well, there's no use giving diindolylmethane if they're on this type of drug therapy. It actually can be complementary. So the daily DIM promoted favorable changes in estrogen metabolism and circulating levels of sex hormone binding globulin. And then, of course, the effects of tamoxifen needed further study. And this was out of the Breast Cancer Research and Treatment Journal in 2017. So 2011 limited phase 1 clinical trial showed patients with thyroid proliferative disease, cancer plus goiter, 300 milligrams DIM daily or placebo for 14 days. Patients underwent total or partial thyroidectomy. Tissue, urine, serum samples were collected. Pre and post DIM levels and estrogen metabolites tested. DIM was detectable in thyroid tissue, serum, and urine of a patient after 14 days. The increased ratio of the 2:16 was estrones were present. It was consistent with anti-estrogenic activity. The conclusion of this study was that DIM enhances estrogen metabolism of TPD patients and can potentially serve as an anti-estrogenic dietary supplement to reduce the risk of developing TPD. It's a 2011 study in the journal Thyroid. You know, kudzu, Puerari, lobata. I mean, I don't know. A lot of people don't use kudzu yet, and it's certainly has quite a few phytoestrogenic isoflavones. It's standardized to 40% isoflavones. It's got the adzin and the adzine that's also found in red clover and soy, genistin and genistein, and then formonatin, which is in black cohosh. So it's reported to interact with estrogen receptor alpha and estrogen receptor beta. Effects are similar to soy isoflavones. Helps improve estrogen metabolism, decrease estrogen aromatization, improves the symptoms of menopause, including hot flashes. It's cardioprotective, and it's reported to interact with both PPAR alpha and gamma, which means it's potentially going to help with weight loss, right? It's going to improve fatty acid metabolism and glucose metabolism. And then it can improve symptoms of metabolic syndrome. It's got some antioxidant activity as well as shutting down or inhibiting COX-2. And then Puerari is reported to reduce alcohol intake in humans as well. So interesting, right? With bone, there's a supportive effect on bone density and reduced bone thinning and post-menopausal thinning of bone in women. So it stimulates osteoprotegerin and inhibits receptor activator inflammatory NF-kappa B, and then suppresses inflammatory cytokine interleukin-6, which is obviously produced by the osteoblast cells. So you're reducing that inflammatory signal that's helping to remodel bone correctly. And then with serum lipids, 2008 randomized double-blind placebo-controlled clinical trial of 19 postmenopausal women, kudzu actually showed that HDL was 34% higher and LDLs were 17% lower and those receiving Puerari. As we know, with metaflammation, we see an increase in LDL, a decrease in HDL. So this is probably due to the global effect of Puerari on metabolic signaling in the body. And this also showed, so this was the Puerari in postmenopausal women, ages 45 to 60. This was a trial of 71 women. So there was obviously the effect on blood lipids, bone alkaline phosphatase, endometrial thickness, and breast parameters for 6 months. Significant decrease in bone alkaline phosphatase, suggesting a reduction in bone resorption and turnover. No measurable changes in breasts or endometrial tissues. And then the last ingredient is grapeseed extract, because grapeseed extract is a fantastic antioxidant. It has aromatase inhibiting activity. It helps with blood pressure. So, you know, once again, menopausal women, perimenopausal women, and as well as men, the use of grapeseed extract helps with endothelial and vascular function. It's important for both men and women. 200 milligrams in 2 capsules, standardized at 95% proanthocyanidins. So studies show that it inhibits aromatase, it downregulates transcription factors of cyclic AMP responsive element of what's called binding protein 1 and the glucocorticoid receptor. And these obviously upregulate aromatase gene expression. So it's helping to turn off the gene expression of aromatase. 2011 study showed that grape seed extract significantly lowered blood pressure as well as heart rate. Once again, you may need another 100 milligrams of grapeseed extract to fully get all the benefits in the endothelium, but there's a significant amount in this supplement. So take it on a regular basis. I think you're going to see some positive benefits, at least as an adjunct for blood pressure and cardiovascular health. 2016 study, 16 clinical trials, 810 subjects. Overall analysis showed significant reduction for blood pressure, 6 to 10 milligrams mercury, and diastolic blood pressure 2 to 4 after grapeseed extract treatment. Impact was more obvious in younger, less than 50-year-old, and in metabolic syndrome cases. Makes sense with the antioxidant effect.